We talk all the time about food. Humans have evolved over feast and famine. There is no famine. There is maybe outside rich countries and Western milieu, but if you are in a developed country, chances are you don't know what hunger is. When I ask someone, when was the last time you've been hungry? I'm hungry now. No, I'm talking about real hunger
Yeah.
for several hours, maybe days.
Welcome to Unconventional Medicine. I am your host, Brendan Gochran, molecular biologist. I am joined by my co host, Dr. Jason Dubois. He is a clinical pharmacist and an expert in immunology and organ transplant. We have a very special guest today. His name is Dr. Job, and you'll want to stay tuned for this, no doubt. He's an internist and a hospitalist for more than 15 years. He's a graduate of the Cleveland Clinic Foundation and Cairo University. He's an expert in obesity and nutrition, certified by the American Board of Obesity. You'll definitely want to listen to what he has to say. He has over 3 million followers on social media. He's a husband and a proud father of 3. Plus, he has a dog, Bruno, who's a beagle, and I'm not quite sure there's a story behind that. I guarantee it. So, Dr. Joe, welcome to the program, and thanks for coming on.
Thank you for having me. It's my privilege.
Very good. I'm going to toss
Dr.
this right
Job,
over to Jason. Sorry.
Yeah, sorry, I jumped in too quickly. But Dr. Job, great to meet you. You and I share kind of a common interest in the sense that we are both classically trained in medicine. And I'd be interested in your thoughts on this because one of the things that happened to me when I started looking into alternative health was a lot of my colleagues didn't really get behind me, certainly didn't endorse me when I started my natural supplement business. And I'm wondering, have you encountered anything along those lines where, you had thoughts that deviated from traditional medicine?
Yeah, I think that's a very good question. No, I did not have any support. Actually, naysayers are a lot more.
Yep.
I was ridiculed. We're talking 4 or 5 years ago, actually about 40 years ago when I started my journey on social media. And the reason I took to the streets of social media because I started, if I could say, like preaching the gospel of alternative herbal medicine, functional medicine, integrative medicine, not Western flavor type of medicine, maybe 10 plus years ago. So it was very individual, but the audience was not very interested because I had to choose the audience. So a friend of mine approached me and he's like a visionary. He told me, I think there is nothing wrong with your message, it's just the audience. So when you go social media, the audience chooses you.
That's a
So
great
that's a
point.
huge difference. A huge difference. But people will always resist the change, regardless it's a good change or bad change. So resistance, I still meet that, but it's less because now they know you're backed up by millions of followers. There is some maybe lends some legitimacy that some people out there believe the message, and it lends some. I don't want to say the word power, but that's what it is. Even social media, they give you a hard time less when you are heard more. They know that the message is resonating with the people. But the way to answer the question directly, it's a toolbox that you decide to use. So if you go medical school the way it is right now, not the way it has always been,
Mm-hmm.
I would say for the good part of the past century, it has developed or morphed into something different. It's just a medication and surgery now, chemo, radio stuff, which I agree with all of the above.
Yeah.
Actually, I enjoy using those, and sometimes they are the best way to address a disease, especially when it's an acute disease. We're talking about not a chronic problem, not high
Mm-hmm.
blood pressure
Right.
or insulin resistance, for
Yes.
instance.
Agreed.
But the problem has become that I feel that this is the only tool set or tool box that I'm allowed to use, should use, learn to use, and I want to help people. I went into medical school really because my father was a physician, but I didn't know that if the only way for me to help people is just to use that toolbox of medications or surgeries, etc., and whatnot. Now I learned that there is more that then that toolbox you're thinking out of, like herbs, exercise, sleep,
Yes.
autophagy, a lot of things. And it's like Alice in Wonderland. Oh my gosh, what am I looking at? All this, and I neglected. We are missing out on low-hanging fruits all over the place.
In your practice, what was one intervention like that was not traditional medicine where you tried something, you maybe you tested out on you or a family member, or maybe you recommended it to a patient and it worked and it started you on that path where you're like, hey, there might be something to this. Was there a
Yes,
particular herb?
you're looking for the why behind the what. I used to be this guy, for instance, or the drive. I'm sorry, it's off a little bit, but that's me more than 10 years ago.
Wow.
And I was overweight, back pain, chest pain, GERD, not sleeping well, foggy brain, headaches, high blood pressure, fatty liver, cholesterol through the roof, triglycerides above 200. And all I was offered is a few pills, just multiple, stress testing, echo stress. I was in my 30s. And
Wow.
it's like, this is not normal. I have to look for the elephant in the room. And that elephant was diet, food,
Yeah.
my relationship with my quote unquote nutrition. We forget in the process of eating that eating is eating a live creature, be it plants
Mm-hmm.
or animals. Both are alive. Even
Yeah.
plants breathe, drink, die. So are you eating alive food or you're eating dead food? Once you switch the model to eating alive food, they call it whole food. To me, it's a live creature. If your food is not dead, you're going to do well. And
Describe
that's what I
that.
did. It
Just
inspired me.
describe what a whole food is versus a dead food, just for people, just give them
Anything
background.
that's a processed, sorry, I interrupted you. You're finished with your
No,
question?
you're good. You're good. Go ahead.
Yeah. So anything that's gone through a process, and the process could be layers between, that's why there is that type of restaurant that's called farm to table. Is it really, truly farm to table now? Far from it. I'm not even talking about cereals and the very obvious ultra super processed foods or drinks or beverages with a ton of sugar. No, the hidden ones. So those are the processed food. This is for the more the processes of processing food, adding sugar, altering protein, decreasing fat, skim fat, low fat, no fat, or adding flavors. There is a job in America, it's called flavorist.
Yep.
Mm-hmm.
And that has 80,000 plus flavors. They call them natural flavors, far from it. And
Right.
the problem is only a few hundred of those are really monitored by institutions. So it's like the company, I have this nice flavor, it's like mochaccino or whatever. And then I take their word, we have tested it in animal models, in human models, and it worked. Am I asking the person who's selling me the product, is it safe or not? This is not a working model. So the more processing our food goes through, including heating and cooking at the end of it, the less valuable. And once you start altering ingredients, it's the way I communicate this to my followers. Food is a language. So assume that your gut, and I don't mean to bring any ethnicity into this, but my gut speaks English and my food only knows Chinese. So my food goes in, and actually Chinese is still a human language. Far from it. My food doesn't speak any language. It's like mute and starts to just spew, if I might say that, vitamins, minerals, and whatnot, and poisons and toxins, hormones, antibiotics, and coloring agents, flavors, all this. None of this is needed, but this is not the only problem. It's empty food. This is where the people coined the word empty calorie.
Right.
Because calories, which is carbs, proteins, and fat, those are the macro nutrients. We forgot about the micronutrients, enzymes, minerals, probiotics, prebiotics, postbiotics, trace elements,
Yes.
essential fats. All these micronutrients are gone. Flavonoids, polyphenols. All this is not food is not only food is not rich in those, it's empty. So I'm taking 100 calories, empty calorie versus 200 calories. That speaks my language. The body knows how to deal with that 200 because we know now there is texting from the postbiotics to the mitochondria and to every cell in the body through the gut. Very complex process because it's a live food and it's a live message. There is no messaging anymore. So no wonder 42% obesity epidemic in the US. No
Yes.
wonder it costs, they say, hundreds of billions. I believe if we really look at the total cost, it has surpassed $1 trillion in
Yeah.
total. And I want to stop here to give you the opportunity to ask a few more questions.
Well, I think you're hitting the nail right on the head. The
Yeah.
issue has been food, and it's been a lack of quality food here in the U.S. And I think we all struggle with finding good food, and I think people that are in particular overweight might even struggle with it a little bit more. I think it is a socioeconomic issue. If you're making over $100,000 a year, you have the means to go out there and get that healthy food easier. I'm not saying it's not attainable if you don't make that certain amount of money, but I think it's just healthy food is expensive in the U.S. And I think we need to see a change. We need to see a shift where quality health food is easier to obtain. And that spans a whole number of topics. Brendan, I know you're very passionate about pesticides and
Oh yeah,
infecting our food
glyphosate and all that. Yeah.
glyphosates.
Yep.
And that's an issue that we still really haven't tackled very well in the United States. Now, I have seen improvement. We're starting to see changes of movement in people becoming more interested in the additives in foods and choosing better. But I think we've done, we just have not done a good job educating children and adults on how to choose better. And I think that's part of the obesity issue we're facing.
Yeah, we're still
agree.
dealing with a food pyramid that's antiquated completely. I want to jump in. I know we had talked about this in the pre-interview. So you were overweight. I want to say 350 pounds, and you dropped a tremendous amount of weight. Now, I know you ran through a number of causes as to why Americans are unhealthy, but I know this is a big passion for you. Is that what led you to lose all the weight? What were the main drivers? I'm sure people want to know that.
I was a little above 200, not 300 pounds, to be specific. But it was enough because it's not the amount, believe it or not. We have the wrong idea about. There is a whole book about how you could be overweight and healthy, and how you could have just a little bit fat, 5 kilograms or 10 pounds, and you could be insulin resistant. So it's not the
Right.
amount. It's called the obesity paradox. And
Yeah.
the author convinced me that what really matters how you're getting to the overweight. If it's just a surplus of calories, but real food is just a little bit more energy than you should have, the body recruits it in the right places, subcutaneous fat. But if
Right.
it's accompanied by, or the way to it is lack of sleep, stress, inflammation, fast food, dead food, we call it SAD diet, standard American diet, or people call it DAD, deadly American diet, then you end up with more visceral proportion or component to it. And that's where the problem is. That's the inflammatory one. That's the one that increases your CRP, increases your interleukin 6 and the other slew of other inflammatory markers that a fat, sick cell that is able, people don't know that. A fat cell can increase its size 20 to 50 times. So when it does that, it enlarges, but it becomes engorged, And that's not healthy weight gain. So some people genetically are able to have more fat cells. So you put a little bit of fat into that fat cell, and you have more fat cells. But if you have less fat cells, genetically or for a variety of reasons after birth, or even intrauterine, it depends if your mom was exposed to certain hunger or starvation, that changes the game for genetic expression, which is epigenetics for you. The genes of the baby before the baby is born change to make him able to adapt to any starvation to come. So we'll change that. You end up with less cells or more cells. Less cells, they engorge more, sicker, ischemic, inflammatory, dying, get inflammatory cells from the blood, fight. There is no infection, but I'm fighting, I'm causing inflammation, and it's a vicious cycle that feeds itself. You end up with inflammatory 10 pounds, and that's all you need. It's like a hot pot of inflammation spewing inflammatory markers all over the body.
So, Dr. Job, are you saying that some people are just from birth set up to fail?
Absolutely. And it's not helping. So the food, the stress, the lack of sleep, I don't want to ignore any of the pillars. I call them the pillars of obesity, of the pillars of weight loss.
Yes.
Lifestyle. Food could be number one, but genetically, yeah, I've seen people, I go in patients' rooms, I'm a hospitalist, 450 pounds, they are eating their pizza, they are at the hospital for pneumonia, A1C 5.2, and I scratch my head, interesting, and they are eating all the wrong things, and they are in their 40s. Man, you should be diabetic, are you serious? What am I missing? Then you find another guy, 35, relatively lean, eating wrong as well, and leading probably same lifestyle, A1C 9.5. Yes. And I didn't know till I met people in the field of genetics, and I just talked before the podcast with you guys about my trip to Dubai, about the geneticist that I met, answered every single question of those. It took 2.5 hours meeting this guy. And it was initially mind-boggling, but at the end of the conversation, that's why. Because nobody has ever been able to answer why this guy will smoke and have problems because of smoking, and this guy's been smoking and his 95 did not have problems. Different genes.
Yes.
You dealt to different genes at birth.
Yes, and it's so what? Gosh, like what do you say to those folks? Or what? How do you help those folks?
So you can't. That's why we call them modifiable factors. You cannot change your mom, your genes. You cannot change your age.
Right.
But the modifiable factors, I just stressed on sleep. And when we say sleep, it's 7.5, 8 hours a night. It's not negotiable. You have to go to bed, and preferably 10 p.m. or earlier. 7.5, 8 hours. People who negotiate to make that 6 or 6.5 and join the club of 5 a.m. and stuff like that, it's wearing you out. And the fact that some people do well with 6 or 6.5 hours of sleep, this is rare, to the point that experts and specialists in the field, to make the conversation around sleep more useful for listeners or watchers. People like Matthew Walker, he's like, I think I would say he's the guru of sleep in the US. Traveling the globe, educating everyone, has been doing this for 20 plus years, says that the likelihood that you're one of those guys who can get away with 5.5, 6 hours of sleep is more than the likelihood that is less than the likelihood of you getting hit by lightning or stricken by lightning. So it's very rare. Don't think if you are able to get away with it, you're living your best life.
So if you're listening, you're not that person. Sorry.
Yes. Number 2, food. We talked about food. That's very modifiable. 3, lack of it. We forgot. Yeah. We talk all the time about food. Humans have evolved over feast and famine. There is no famine. There is maybe outside rich countries and Western milieu, but if you are in a developed country, chances are you don't know what hunger is. When I ask someone, when was the last time you've been hungry? I'm hungry now. No, I'm talking about real hunger.
Yeah.
for several hours, maybe days. Like I tried 3 days of long fasting. They call it, once you cross 1 to 2 days, extended fast to tap my autophagy. And we can talk about this later, but this is the fountain of youth, if you will. Autophagy, Yoshinori Oshumi, he's the researcher in the field. He was awarded Nobel Prize in just autophagy in 2016. Then we
So
go exercise and movement.
yeah, let's switch to that topic, because I think there's some meat here, so to speak, right? Autophagy, for our listeners, a simple definition for what autophagy means, and then let's talk about fasting and how to do it.
Auto is self, or automated process. Phagy is eating, so self-eating. Is that what really happens? Kinda, sorta.
Mhm.
I would like to liken it to self-recycling. Once you have surplus of energy and resources, you're not paying attention, you're becoming lazy, less motivated to do stuff. But when resources become very scarce, you really think again, am I using my resources correctly? Do I need this guy to be growing in me? And it could be just at the beginning of a new plastic process, for instance. No, probably I should not spend calories on this guy. Oh, do I need that fat? No, fat is not that important. Actually, hold on a sec. We store fat to use it. Our bodies forgot that we actually store fat to use it because we never do. Why? Because how can you use fat? When you're very hungry, you have no input of glucose, because people conflate or confuse sugar in the food to or with sugar in the blood. You will have sugar in the blood regardless. If you eat zero sugar, and I'm not saying this is the best or the healthiest way to eat carnivore. I'm not saying that. It could be one way of starting something. But if you eat zero sugar for days, well, where is the sugar glucose coming in? And you can't have zero sugar in your blood. We will die. We need
Right.
it to be 60
Right.
plus. They say 70 plus, but it is 60 to
Yeah,
90.
that's a sole energy source for the brain. So clearly that's not
Yes,
gonna fly
I
with
will
the
tell
body.
you something. That's another actually debatable topic. When you really come to think of it, the brain prefers ketones.
Oh,
So once
interesting.
you
Okay.
have scarcity, yeah, once you have scarce, babies are born in the world in ketotic state. And that's why premature babies don't do well, because they don't know how to tap that resource yet. Because they are not plump, they are not chubby yet, they don't have the fat to turn into fatty acids, and fatty acids into ketones in the liver. They liken it, if you have a chicken, that's a free fatty acid just broken down from fat, subcutaneous fat. Smaller pieces in repackaged in the liver, we call them acetoacetic acid and beta hydroxybutyrate and acetone. Acetone is just very easily evaporating. You breathe it out. That's why we smell ketones in the breath. But the brain loves, not likes. The brain likes sugar, but the brain loves the ketones. And actually, most of degenerative diseases, you can say epilepsy, Parkinson's disease, Alzheimer's disease, if you're so hungry to the point of tapping your fat, changing those into the liver to ketones, because the brain cannot use free fatty acids, ketones. Those are energy.
Yeah.
Only then, because of lack of sugar, I make sugar from fat. It's called gluconeogenesis, the process. So even if I don't eat any fat, I am breaking down my own muscles every day in a cycle. There is amino acids coming out. I turn those into sugar. So there is your sugar. What does the brain do though? There is sugar. The brain will switch to a weird model. Weird, it's not weird. It's surprising for us. It's not a paradox. It has always been the case. The brain would happily tap 70% of its energy from ketones and only 30% from sugar,
Oh, that's
preferably.
interesting.
And
Yeah.
actually, ketones go to 1 millimole, just a little, to be a really ketotic state, 3 millimole, 4 millimole, 5 millimole, that's super ketotic. Then you might be in trouble. You need to go to the ICU unless it's in nutrition. That's why we call it NK, nutritional ketosis. But once you are one, that's low ketones. The brain switches from the one, despite having 90 in the blood of glucose, and starts to use those ketones despite having sugar because it
Oh, wow.
loves the ketones more.
So it
So when
prefers
we
it.
are
Yeah.
in autophagy, tapping my own fat, I have ketones. The brain, the vessels dilate, according to a study I read, 39% increase the blood flow to the brain. Less epilepsy, more focus, less confusion, more steady source. If you will, hybrid car. Sugar is gas. You're using electric power if you're on ketones.
So bring it back to helping me or Brendan or a patient. We want to try fasting and we want to start that internal healing effects by stimulating autophagy. How do we do it? Where do we start? What do you tell
So
me?
it's a training because it's a learning curve because our bodies are rusting. Those storage places we call fat that could be unbelievable numbers. We're talking if you have 30 pounds of extra fat, which is not hard to come by these days, each pound is 3,500 calories. Multiply, it's about 100,000 calories extra. You need about 2,000 calories a day for a man and 1,600 for a woman. So you're talking 50 days of not eating anything. Your body could do it. Really? Are you advising me to do that? No, you don't, because I'm not, because if you drink just water and you don't eat at all, there is a chance of severe vitamin or vitamin deficiency. You end up dying because of lack of vitamin C, scurvy, or vitamin B, beriberi, or B1, beriberi, but or thiamine deficient. A lot of other deficiencies could kill you before you finish your fat stores. So the way to it, and it's been done before. It's not. This is not something. I always have fun asking people, "What's the longest fast?" Do you know, guys, the longest fast?
No, I
With
don't.
water.
With water, uh,
I enjoy doing it. I torture people.
30 days,
Go up a little bit.
Wow. 45?
50
Actually,
days.
it was in 1965. His name is Angus Barbieri. He still holds the record for the longest fast in the world, 382 days.
Oh, my.
Oh, wow.
He's a Scottish. It was done in Scotland, if I recall, under observation. And he just did water, vitamins, hot tea, and coffee. 0 calories. He was 456 pounds. He took it all the way down. Pictures are all over the place on the internet, usually in black and white, obviously.
So,
But he
Dr.
was
Joe,
180, from 456 to 180.
so I have to interject. So I don't think you know me well enough. I love food, right? So I love to eat food. You're asking me to do something, and you're asking my listeners to do something that is not something they're used to doing. And food brings me joy, right? It brings me comfort, and improves my mood. So let's say I want to dedicate myself to doing this. How do I get past that initial hump?
Good.
And where is that tipping point where it's like, okay, I don't really want food as much as I
Thank you for
did.
reframing. There is toxic hunger that we're living through. This is the era of toxic hunger. 2 hours after the burger, the French fries, and the beverage, you are so hungry because there is a huge amount of insulin causing a crashing glucose curve from 180 crashing all the way to 110. And maybe in 1 hour, the brain watches this. Where am I going with this? Is it going 60? I have to make you hungry again. You wake up 3 a.m. and you eat. This is the worst form. Night eating could be the worst form or worst indicator that you are a food addict. Is food addiction, sugar in particular, is addiction more than anything? Has it been proven, and is it reproducible? Absolutely. Mice love sugar, water with sugar, orally, and prefer it over IV cocaine.
Yeah.
We know that. They choose that over this. So we are witnessing the food addiction epidemic, which is leading to many problems. One of them is obesity and a plethora of other diseases. How can you get over that? I'll give you back to the story of Bruno. Yes, this guy has a story. His 4.5, my dog, Bruno, is a beagle. I never had to do anything with feeding him. It was just the family, dry food, because if you want to feed your dog healthy food in America, it better be dry food. Really. 100 years ago, what were dogs eating? Dry food? I doubt it. It did not exist. So
Right.
what did they eat? What's the relay? I always joke about it. Why are dogs so passionate about bones? Like a dog with a bone.
Yeah.
Oh, maybe dogs like meat and maybe they like bones and real food. So this guy, he's fourish, is not even 5, and we're talking dog years, probably like a 35-year-old man, not even. He's like in youthful, very young. Ulcers, depressed, not wanting to get out of crate, limping, autoimmune disease. His vet was not equipped to identify. Ball on his 2 joints, on the right knee and the left knee, bigger on the right knee, inflamed,
Yeah.
scratching it, licking it, bleeding from it, wants to die. Paying $700 a month at the first visit. Second visit, steroid injections. It's the epitome of epic failure.
Right.
Then I told my wife, "Can I play vet for a?" And they could not imagine me taking over, despite everything I'm doing. But I'm not a vet, and I'm not a vet. So they just give me the opportunity, guys. 1 week. That's not too much. He's dying. He is gonna die. And I love this dog. We all love him. They said, "Okay, it's 1 week. If it doesn't work, you're out. That's fine."
Well, there are a
What
lot
did
of
I do?
people. There are a lot of people out there that
Autophagy.
identify with this. Yes, right, exactly. I knew where you were going with this, but
What
there's a
did I
lot of
do?
people
The
with
first
issues.
thing, yes, Brendan, the first thing I did, make him hungry. And it was hard. It had to be me doing this because I
Yeah.
made him like really yearn for food. Like his body has to 12 hours, 16 hours. Then in that hour window, this is how we start. 6 hours. It's not the same for dogs, should not be. But I took the liberty. He's dying. He's gonna die. And in the process of dying, he will cost me probably $50,000, $100,000. So I really saved myself a ton of money. So eventually
Side
boils down to
benefits.
money. But really, literally, I fed him only carnivore diet. Chicken, eggs, maybe a little bit of cheese, no sugar, no bread, no dry food, nothing but meat, even oxtail, bones, anything that you'd imagine a stray dog would be eating. And where I come from originally, 20 plus years ago, we have a lot of stray dogs, and I know they were very healthy because they were very hungry. We
Yeah.
don't know that autophagy, which is a fancy word to being hungry more than 18 hours. And autophagy is not a button or a switch, turn on and turn off, far from it. Once you're fasting, no food, but you're drinking water after for humans, 16, 18 hours. I'll get back to Bruno. He's well, alive, happy, eating, drinking, enjoying life, no sugar. So back
Yeah.
to your question. Is he enjoying life? He's very grateful. These dogs can express gratitude more than humans. He comes, he pats me, he's thanking me every single day. He knows because I never had to feed him. Now I'm the guy. I feed him every day. He lost. He was an overweight dog, like every 44 pounds. For people with a beagle, they know this is a lot.
That's
Now
yeah.
he's low 30s.
Yeah.
Yes, that was a big number. Now he's low 30s. Ulcers are gone. He's not licking. He's not allergic. No steroids. He doesn't see the vet. He will never see the vet again, in my view, this way. As further away, we might change our address to not go to the vet. I'm joking. But the message is, and guess what? In 1 week, he was able to walk. He was still limping. He wouldn't be able to jump in the car. 2 weeks later, he was, but he wouldn't go up the stairs. 3 weeks going up the stairs. Now we're 5, 6 weeks into it. This is just fresh off the press, like they say. He is almost back 95%.
Yeah.
And I joke about it. I seek validation every day with my kids. They deny it. Oh, no, I think he was going to get better anyway. I know if we put him back on dry food, he will be worse in a few days. Tapping autophagy, back to autophagy, and I'll finish my thought in 30 seconds. It's like a light dimmer. You turn it on at 18 hours of fasting, 24, it's 2, 36, it's at 5, 72 hours, you are closer to 10%, 10 or 100% tapping your autophagy, eating your fat, eating your redundant inflammatory cells, because inflammation in the eyes or in the opinion of the body is luxury. Back pain was gone after 3 days of fasting. I grappled with back pain for years. After 3 days fast, it's gone because body cannot afford to inflame me. I'm dying. I don't have time to inflame you. We have to look at our resources. Even I'm saying, I don't want to say the word, but even if there is a growth inside of you,
yes,
that's going to eat you away in the next few years, your body might decide to eat it. This is the time. What's that? We let it before grow because we
we're in
had
surplus.
surplus.
Yeah.
But now with this, it's either me or you, dude. That's the body language to the growth. No, you're out. I'm eating you.
So it's almost like you're turning on the immune system in your favor.
Absolutely. But with the caveat, we know that when you are autophagy, when you are in autophagy, if you take it too far, if you do autophagy for 48 hours to 72 hours twice a year, which is the fast for extended fast, you boost your immune system 50%. With the caveat, in that time, you are more vulnerable to infections because you killed old soldiers, you ate old, you recycled. Like those are proteins, amino acids that you recycled to use them for better purpose, to live, to push on. So it's like marathon. It's good because you're going to be healthier, but immediately after marathon, we know you're 7 times more likely to have a viral infection than before marathon.
Yes.
Oh, that's interesting. All right. So
you
do this during the summer when you're getting plenty of sun.
It's like pregnancy. You are sick. Women, they pay dearly for being pregnant to the baby. Actually, we know now that this is why there is an entity called gestational diabetes during pregnancy, because mom is not important in the eyes of evolution. Mom is not as important as the baby. This is the offspring. This is the progeny. This is my extension.
Right. Prioritizes.
I'll be insulin resistant as a mom to provide more glucose in the blood to grow a placenta and to grow the baby. This is why it unravels or it shows. If you're pre-diabetic, you'll be diabetic because you are more insulin resistant by design during pregnancy. Does that make sense?
Yeah. 100%. Yeah. Especially when you explain it that way. I think I never really thought of it that way, but interesting.
I learned that from books like Dr. Benjamin Bickman. I'm not sure if you heard about him. I don't like to use anybody's explanation of things without giving them credit. Dr. Benjamin Bickman, he is the guru of insulin resistance in the US. He's Utah-based fat cell biologist. And of course, the fat cell biologist, this is my dear area of reading and research. I love this guy. He's amazing. He is a beacon to anyone who wants to learn what insulin resistance is.
Yeah. Just for the listeners, and maybe you can set me straight if this is not correct, Dr. Joe, but the body during autophagy definitely prioritizes damaged cells. Is that correct? So it sort of leaves the healthy cells alone?
It's very smart. If you know the way the body does it, you'll be like, guys, when we say body, we make it sound like the body. The human body is about 30 plus trillion cells with a T. Trillion, 1,000 billion. The human brain, I like those numbers because I just want to show the complexity of what we don't know, so we know what we're talking about. The best machine ever made.
Yes.
All right?
Agreed.
So the human brain is about 86 billion cells. Neurons. Each neuron is connected to the nearby neuron by about 1,000 to 10,000 connections. This is half a quadrillion cells and connections. This is madness. This is crazy. Who takes care of that? Me? By fast food? No, it does take care of itself. And by the way, I always love to ask that question to anyone, because once you have a question popping in your head, not answered, you will never forget it. I teach a lot. How long do you think our veins and arteries in our bodies? I'll get to the point. I'll drive the point home after you answer. You try to answer. The length of our vessels, arteries, and veins in a human body.
How long
total?
in distance?
Oh,
How many
goodness.
meters? What?
Meters?
I'd say, what's it?
I don't know.
Probably crazy, like 10,000 miles or something. It's phenomenally high.
60,000 miles at least, could be 100. So
Okay.
the three of us could reach the moon using our vessels. Who's taking care of that? Vegetable oils? Canola is? Canola is, right? Seed oils.
Right.
Corn oil. No, none of that. It has to be
Cereal,
fasting,
artificial flavors.
sleeping. There you go.
Glyphosate.
So you have to just, and I tell people, it's a shame that we use better oils for our cars than our oils for feeding us.
Oh man, that's so
We
true.
have a superior machine that's been hurt by very bad type of oil for the past decades. But guess what? The body is so resilient to the point that in our 30s, if you have a crazy change of lifestyle, a commendable one, I mean, you could add several years to your life. And the best way, if there is anything you could do to increase your longevity, it's not food. It could be the lack of it, fasting. And it's debatable because it has been easily reproduced in mice, not so easily reproducible in humans. It's a different ball game, especially because of how complex our microbiome is. But exercise, fasting, sleeping, I would put food number 4 when it comes to longevity. And there are stars in the field. I think his name, Dr. Walter Longo. He's a longevity specialist in the US. He wrote the book Longevity Diet. He has something called FMD, fasting mimicking diet. I respect his work. And when you read how autophagy makes you a better machine, and what people forget about, your cell, as we speak now, Brendan's, Jason's, Basim's, or Dr. Job's cells, could be now, we are producing different cells. It differs from one organ to another. Like brain cell could live for eons, but tongue cells, gut cells could be days, and the lung cells could be living months, bone cells years. But eventually you'll change it with a different cell, to the point they say in 11 years you don't have a single cell in your body that is
Original.
Right.
Yeah.
or you had it 11 years ago. What I'm trying to say, if I'm in the process of rejuvenating, renewing every cell, the question that is important, do I replace it with a better cell? Is it even possible? Because I'm aging.
That's a great point.
Aging is not a disease.
Yes. Thank you
Aging
for saying that.
is not. Aging is a natural process. It's like withering away like a flower, but you don't have to have high blood pressure is not aging. Alzheimer is not aging. Parkinson's could be genetically, could be pesticides, could be a lot of things, but it's not aging. Yes, genetics play a role, but it's not aging.
Yeah, and I'll tell you, for the viewers at home, when they walk into a doctor's office, that whole list of problems and symptoms, that always seems like it's always answered by the conventional doc says, don't worry about it, it's aging. This is a totally natural process that you're going through. So please tell folks it's not.
It is not. You could be, actually, there is a guy who traveled the world. His name is Dan Buettner. I should refrain doing that and bringing names because sometimes I try to come up with the name and I forget and it looks bad, but I remember this name. Yeah, at this age of mine, aging. So Dan Buettner wrote a book. It's called The Blue Zones. Have you heard about the blue zones?
Yeah,
The areas in the world that he visited with the highest numbers of centenarians.
Right.
I've met in my career working at the current hospital I work at for the past 17 years, maybe. I can count on one hand how many centenarians. And I actually, one of them, I shook hands. She was 107.
Wow.
And she came to the hospital with the UTI. She was sharp. In 106, another guy, and another one was dying 102 because of a hip fracture. They are three. I just counted three.
Wow.
I don't remember anyone else. 90s, which we call nonagenarians. No, I wouldn't even say hundreds. It's thousands, and probably a lot more if it's 70s or 80s when the average age is 80. What I'm saying that Dan Buettner, he circled with Oprah Winfrey those places on a map with a blue pen. That's why they call them the blue zones. That's how it came about. And he showed her that those guys live naturally, reproduce naturally. Some of them, even he didn't talk much about this because of the controversy. Some of them even were smokers. And I'm not encouraging smoking. I'm saying that you could, but it's certainly
right. This is the resilience of the body.
Away. Yeah, certainly it ruins your body, but they were able to make it.
Right.
So reproducing, walking, talking, sleeping, drinking wine, eating whole food, and eating goat cheese. Some of them were pescatarians, some of them were carnivores, and some of them were vegans. And it didn't really matter what you eat as long as it's very natural and you're able to satisfy every single need the body needs from the micronutrients, the baby ones.
Yeah, sorry.
I'm sorry. I think it was because of what they ate or what they didn't eat. And then I think it also was attributed to their social life. So they had a much more robust social life.
That's what Dan said.
Yeah, interacting socially.
Jason, what you just said, I would like to actually emphasize it, cannot overemphasize it. Which is more, I go live a lot. I ask my guests, which is more important in your opinion, to stop toxins and poisons onslaught on your body, or to eat very healthy? They tell me both are important. I know that, but if I get to choose, I do one. Which one will give me the best bang for my buck? Fasting and stopping. If the dog fasted for 3 days, I couldn't stomach doing that, no pun intended. But I couldn't do it. But if I fasted him for 2-3 days, he would have not died, but it would have been torture and it's like a psychological trauma, but he would have cured much faster than try to give him energy, because when body is in autophagy, it's just all bets are off. You are going you're looking for everything that's wrong with this machine. Because there is, I'm not sure if you heard about that, in the human genome, there is about 26,000 genes. About 500 of those, housekeeping department. Because of the lifestyle between sleeping, lack of fasting, eating the poisons, the toxins, lack of phytonutrients, blah, 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 about 100, and it's like an oversimplification and could be exaggeration, but arbitrary numbers, not really. 100 of them are really working tirelessly. But once you go fasting, you could go like 500. All of them are serving you. This guy is literally dying. Let's see what we can do. What we can do? We can do a lot. We were just sitting back and enjoying the ride, not knowing that it will be a short ride, a diseased ride. The body is not designed for longevity thinking. The body cares more about the next few weeks. At least should take priority. So and when you hurt yourself, what are you going to do? Eat more seafood, eat more vegetables, eat more fruits. Right. I tell people, and I will finish my thought in 30 seconds to give you the opportunity. There is no one who's 120 pounds because of eating too much fruits. It's pizza, it's fast food, it's sandwiches, it's beverages, it's juicing the fruits, not eating the fruits. It's GMO, it's the pesticides, lack of sleep, stress, inflammation, etc., etc., etc. So it is a lot more important to stop poisoning our bodies and detox naturally, because there is a lot of detox stuff out there. I believe in some of them, but the best detox in the world is called liver, water and liver.
Okay, you definitely hit my topic there. That was a great summary, and I'm on board with everything that you just said. So I know we're going to have to wrap this up. Let me jump in just with one additional question, and you've hit on a lot of different areas, and Jason threw one in there that was really good, which is social interaction, which is really important. I would throw one more in addition to that, which would be prayer for the folks out there who are faith-based. Is there a system, and I apologize, we're going to have to narrow this down time-wise. Is there a system out there, because you've been here in the States and you've been international, that does medicine better or possibly best? And it's probably
I think
not here in the
functional medicine.
States.
I think functional medicine has a better, they call it 30,000 foot view. They don't treat organs. They don't have, and I'm not opposed to this because for dialysis, you need a kidney doctor. Absolutely.
Yeah.
I used to be a nephrologist actually back like 20 years ago, a mini nephrologist and a fellow where I come from in Egypt for a couple of years. Saw a lot of transplantation patients, and I see hematology docs, oncology docs, and all of those specialties. But functional medicine, 30,000 foot view. What's causing the ailments of, because you could all tie it down. ED, erectile dysfunction, chronic kidney disease, high blood pressure, Alzheimer, they call type 3 diabetes now. All those guys I just mentioned, and fatty liver is insulin resistance.
Absolutely.
What causes insulin resistance? A lot of carbs. Are we eating a lot of carbs? 50-60% of the current calories, the upside down pyramid. And please, you have to take my permission bringing the pyramids again because I'm Egyptian. Pyramids. But the real pyramid, the nutrition, the food pyramid is upside down because we should not be eating. Listen, there is no better way of saying it. If you don't eat protein at all, you will die. Actually, a blogger, a food blogger in Russia recently died because she was eating just fruits. If you don't eat proteins, because very, very, very poor source of proteins are fruits. If you don't eat fat at all, zero fat, you will die, but in a few years, maybe a year or two. Could be less, could be more. But if you don't eat any carbs, not only will you not die, you will actually get much better. So am I in the carb banning van? No, I'm not. You could be the way of like autophagy. I don't want you to autophagy every week. We're saying a few times a month, or maybe once or twice a year, up to you. Exercise, sleep, and just eat whole food. So paleo diet is the best. So to really drive this home for your listeners or watchers, if you want to change your life, look what paleo is. No grains. That's before the advent or the era of agriculture, domesticated animals, before eggs. And not that I'm against eggs or chicken or anything, but it used to be if you hunter gatherer. So they used to gather, but hunter is first. So you hunt animals. So say 70-80% could be animal products, could be seafood. Maybe when you can, you get some legumes, maybe some fruits. Nuts are fruits, by the way. Most people don't know that type of fruits. That's it. Grains, I could live with them, but I'd better be living without them. And I will stop here.
Grains are for cows and horses, right?
I'm gonna get one last question, Brendan,
go ahead.
if I can just sneak this in. And I only ask this on podcasts where we have medical professionals. Dr. Joe, tell me your top 3 natural remedies, herbs or otherwise, for our listeners. I have my 3. Brendan has his 3. But today, it's all about you. You have the floor.
That's a tough question because I do it by ailment, by disease. It depends what you have. But every time I look, I will choose curcumin or turmeric as a top one, because it seems to be involved in every inflammatory process, neoplastic process, to the point that I've read about 80 ways turmeric or curcumin, the 3% in turmeric, that's able to fight disease and reverse neoplastic processes. That would be my number 1. Number 2, I don't want to say berberine, but it's up there for insulin resistance, and the book that's called Why We Get Sick. That's Dr. Benjamin Bickman. It's all about how you get rid of most of Western diseases by reversing insulin resistance. So if there is an herb or there is something that could reverse that process, it could be berberine. I'm a big fan of also any type of, and I'm not sure that's not an herb. It's not apple cider vinegar. It's vinegar. Because vinegar, acetic acid, the 6% or 5.5% of acetic acid in date vinegar, apple cider vinegar, even white vinegar, which I don't like or don't prefer. It works in very three quick processes. Number one, decreases the amylase process of breaking down starch into sugar. So less sugar delivery to the blood. And when it goes to the blood, it gets stored faster because of acetic acid into the form of glycogen, which is our animal form of starch. That's number two. Number three, it increases the machinery of mitochondria, so it increases your burn. This is like not double, it's triple punches in one thing. So I would include that in any type of salad. People go to the length of drinking. I wouldn't recommend it because of teeth. Even in water, it will hurt because it's very acidic. But those are top three that come to mind. But I could give you a list of 15, 20, but I would put all the remedies, all herbs. And my dad, I told you he's a physician, sometimes jokes about me, are you becoming an herbalist now? I'm not, but because I'm a drug specialist, actually a doctor who deals with drugs in a professional manner, and it's a two-edged weapon. I would put the whole ashwagandha, shilajit, all of these guys. Even see, I have stuff like this, like spirulina, and I take it sometimes. So I'm aware of all that in the superfoods, and I think there is some hype to it in a 10% only. And I tell people, if you smoke, you don't exercise, you don't sleep, and you eat fast food, and you ask me about spirulina, I will refrain from answering, because you're telling me you're worried about A+ grading when you have not secured not failing.
Yeah, you've got a solid F in other categories. Yeah, and you're going for bonus points. We are definitely okay. So for the viewers out there, now you understand why we have Dr. Job on the show, and now you know why he's got such a loyal, large social following. The information that you gave us so far has been absolutely tremendous. We're going to have you come back on a part two. In closing, is there anything that you want to say? There's some social media outlets that you want to make the viewers aware of?
Just be aware that the best way, you're not, if you're watching this and you're really interested in this, probably you're not living the best form of life you could live, because it's very close and easily attainable without money. The pillars of health: not eating sometimes, try to be hungry for a few hours, and it comes in waves, hunger waves. You will you ride the wave, and a few hours later, after you drink some water, you'll find yourself you're not hungry anymore. We could get into that later. Movement, action, exercise, walking, sleep 7.5, 8 hours a night, then food, and 5 would be my supplements. But I think in that order.
That's perfect.
Well said.
Yeah.
Well said.
Dr. Job, thank you so much for being on. Really appreciate it.
It's my privilege. Thank you.
Folks, if you've enjoyed this, please like and subscribe, and we'll have more guests on like Dr. Job in the future. Thanks so much.